Hello, my name is Haley Ford, and I am a speech language pathologist. And I just want to thank you for meeting with me today about your son, James. I'm going to be going over some case history information with you to get a better understanding of his communication. And it's going to take about 15 minutes, so we can go ahead and get started.
Okay.
So, James was referred by his pediatrician, correct?
Correct. His pediatrician and his teacher.
Okay. And so what are your main concerns about James' speech and language?
Well, I just don't feel like he is able to express himself like he needs to. I think he's very intelligent. I don't think that's an issue. But I feel like as he has started towards school, he doesn't spell well, he doesn't write well, and he has trouble communicating concrete thoughts. I can understand him when he talks. I understand what he's trying to say, but sometimes he gets frustrated because he can't express himself the way he wants to, and thoughts and ideas.
Okay. So you said that you understand him well. Would you say that everyone else around him understands him well, like his peers and his teacher and other people in the house?
Well, yes, I think people can understand his words.
Okay.
They don't always understand what he's trying to say. What he gets confused. He gets frustrated trying to put ideas and thoughts together.
Okay. How does he express his wants and needs?
How does he express his wants and needs? Well, I mean, he can speak and he can talk just fine. So if he, wants something to eat, he just says, that's what I want. So, and I certainly understand that. I think it's bigger thoughts, more not necessarily I'm tired or I want a banana. It's more like ideas, that he just has a hard time putting thoughts together, like thinking through a sequence of events, what you're going to do today. I want to do this and this, then this. Or what had, an idea of what someone has done, or those kind of things that require more abstract thinking.
Right. So he can communicate directly, like simple wants and needs clearly, but it's hard that it gets to kind of more critical thinking and stuff like that.
Correct.
Okay. All right. And how does James respond to speech? So if you are giving him direction or instruction, how does he respond to that? Or when he's called from another room?
Like when he's called from another room, like if I say, let's come eat.
Mm-hmm. Yes.
He'll come eat.
Okay.
Yes.
If you tell him to do something, like if you instruct him or ask him to do something, how does he respond?
Yes. Simple instructions like pick up your socks. Yes. Go take a shower. Yes. He can do all those things just fine.
Okay. If you ask him a question, does he usually answer to you? Like if you ask him, how was your day?
So that would be something that would be a little more complicated. He might just say good and avoid having a big conversation about it, but he would struggle with saying, we had a test, I didn't do very well on that test, or we played at recess on the playground and a friend and I had an argument, those kind of things. Those, long conversations don't happen.
Okay. I understand. All right, we're going to move into some health history. So, has James been hospitalized in the past 2 years?
He had in the last 2 years, no. When he was little, he had like a lot of ear infections. He's had his tonsils out. He had tubes when he was young, tubes in his ears. But no, he hasn't been in the hospital in the last couple of years.
Okay, so how old was he when he started having ear infections, and when was his most recent one?
Well, it was when he was young, started when he was about 6 months old. And so several years when he was young, and he had tubes in his ears when he was about 3. And
So-
then, I'm sorry, what?
He hasn't had an ear infection since
No,
the
no.
tubes? Okay. All right. Is he being treated for a chronic condition currently?
No, he's fine. He's pretty healthy. He has some allergies, but we
Okay.
all do.
Mhm. All right. Has he ever been seen for a speech or hearing evaluation in the past? And if so, did they refer him to therapy?
He was evaluated. I'm not sure how extensive it was. He was evaluated at school, but they didn't really find anything. And I don't think they recommended necessarily anything, said he was just fine. He was very smart. And I think he is very smart, but nothing really flagged that they recommended anything.
All right. And so developmental history. When you were pregnant with James and in the hospital during birth, was there any problems?
No, it's just,
Good.
pretty, I mean, as far as births go, pretty easy. Wasn't anything out of the ordinary.
How much did he weigh when he was born?
I think it was about 8 pounds, 3 ounces.
And how old was he when he said his first words?
Let's see. That's a tough one. I'd have to look back in the baby book, but he was over a year, 14 months, maybe.
And how about his first steps?
Just a little over a year, probably, let's say 13 months.
Okay. All right. And when he was a baby, did he play games like peekaboo or patty cake?
Yes. Loved it. Yes.
Aw. All right. Who lives in the home with James?
He lives with me, and he has a little sister who's 5.
5?
Mhm.
Okay.
She
And
tortures him. She loves him to death. She just wants to be with him all the time, and it just drives him crazy.
Oh.
'Cause he doesn't want her in the room with him every
Oh.
minute. But that's a little
Those
sister.
little siblings.
I know it.
That's funny. What is the primary language spoken in your home?
English.
English. Okay. And is there a family history of speech or hearing problems?
Speech or hearing problems? No. His grandmother and aunt both had some reading, maybe problems, maybe like dyslexia. But I don't know if that's speech problems.
Yeah, I would say more like language problems, difficulty like comprehending the reading.
Yes.
Okay.
Yeah.
All right. And what kind of school does James go to?
Local public school.
Okay. So elementary school.
Oh, yes. Yeah.
Okay.
Sorry. He's
No,
in
you're
first
fine.
grade. No,
First
second grade. He's in the second grade.
Okay.
Time flies.
Yeah, I'm sure. Does he have any toys or games that he loves? Like, what are his favorite things to play?
Well, he likes puzzles. likes Legos. He has a train set that he really likes. That train is what his little sister, Marcy, she's always wanting to come in and play with the train, and that's a big problem. But yeah, the train is his favorite. But he loves to play with Legos. He's got lots of Lego sets and puzzles and stuff, and he does very well with those. Very creative.
Good. That's awesome. Is there any other information that about his speech, language, or hearing that you just want to address?
No, I think it just is frustrating for him to not be able to express himself, and I can
Right.
tell it frustrates him. And sometimes he just won't talk, and
Mhm.
sometimes when he's trying to have a conversation and tell you some kind of complex thought, and it just won't come, that he
Mhm.
just gets mad and just throws something sometimes, or just stomps off, or
Yeah.
sometimes
Yeah.
expresses himself like that. So I know the thoughts are there, but
Mhm.
he's just having a hard time expressing them.
Yeah, I understand that. It's pretty difficult when you're trying to get a message across and can't seem to explain it in the right way for somebody to understand it. So
Right.
yeah, that frustration is definitely valid for feeling like that. Well, okay. Thank you so much for meeting with me to talk about James. We're gonna go over his information and do some more exams, and we will get back to you.
All right, sounds good. Thank you.
Thank you.
Bye.